Welcome everyone. Thank you so much again for joining us. This is the first event of our 2021 Spring into Service series, and we have called this Starting Your Journey to Impact because it really is going to be a great introduction to some amazing service programs that serve nationally as well as internationally. And how it's going to work is we will have a panel discussion amongst our partner organizations, and then we're going to have like a mini restroom stretch time in between before we have our breakout rooms where you're going to connect with your top organizations that you want to learn more about. And then we'll come back together with a group and make sure that you know about our second event that's coming up on April 6th. And I guess I should just briefly introduce myself before I share who else is in this space and going to be speaking today. My name is Naomi Ross. I am the Americorps recruiter placed at UM. I'm newer to the role, but it's been really amazing. I am a 3-time Americorps alum myself, and it's incredible to have this opportunity to engage others in finding their way to careers in service. So I'm also going to put up my slide for our amazing partner organizations that are joining us today, so you just get a sense of who is in this space. And then we'll get into our panel discussion, and everyone will be sharing more about their organizations. We have Africa from Cydia. She's a national recruitment manager for the South region. We have Roxy from Public Allies Miami. She's a site director. We have Emily Baker with Americorps NCCC and FEMA Corps. She's a program associate from the Southern region. Jasmine Newson is from Teach for America. She's a recruitment manager. Then there's Dustin Arsenault. He's with National Health Corps Florida. He's the Americorps Program Director. Anna King-Midas from Florida Vista Network. She's an Americorps Program Manager. And we have Johnny Mendel from Repair the World Miami, the Executive Director, as well as Taylor Mesher from Peace Corps, who is our regional recruiter based in Miami. So I'll just preface this with the main question we're going to be asking our fantastic partner organizations is what impact your service programs are making on key social issues facing the world right now. We're about 1 year out. That's kind of the big thing from this wild ride everyone's been on. And so what does that look like now for the work that you're doing? And how has service changed from before the pandemic to now? You know, are you doing more virtual work, in person, a combination? What does that look like for you? And really, this is meant to be kind of an organic discussion. So you can bounce off of what someone else says and just chime in, you know, what are your service members doing? Things like that. So whoever wants to kick it off, we have everyone in this space now. And if you want to, before you speak, if you're the first one to speak, just say who you are again, your name and your organization, and then feel free to answer the questions.
I guess I'll start us off. Hello, everyone. Good afternoon. My name is Taylor Maher. I am the Peace Corps recruiter here in Miami. I was a volunteer in Guatemala from 2018 until March of 2020. I was one of the volunteers evacuated due to the COVID-19 pandemic. And I guess just touching on what has evolved since the pandemic started for Peace Corps, all of our volunteers were taken out. So there are no volunteers in the field now, and we will not be sending anyone back until most likely December of 2021 or January of 2022. But I don't want to discourage anyone to at least look into Peace Corps or start your application. It's never too early to get on it. You know, you have to submit a resume and a motivation statement, so I can definitely help with those two things. And the agency, you know, as a government agency, Peace Corps has been functioning all throughout this pandemic. We've been completely virtual. We still are. And I did join the team about 3 months ago as a recruiter. So It's been great, and that's kind of what we've been going through with the pandemic. I'm not sure if anyone else wants to add.
I can follow that. Good afternoon, everybody. My name is Roxy Asuaje. I am the site director for Public Allies Miami. So we are an organization or a movement that places young adults in nonprofits in the nonprofit sector to help organizations backbone so the organization can deliver programs and services more effectively. And this year we actually transitioned. We went through like a major transition here in Public Allies Miami, and we launched a new program model along 5 other cities. So the city of Cincinnati, the Bay Area in California, New York, New Orleans, and Detroit. Along with Miami, just launched a new program model called the Public Allies National Cohort, where allies continue, serving locally in nonprofits or government agencies, but they meet virtually, for training and learning, across these 6 cities. So it's very exciting. We're doing affinity groups and cross-sector collaboration. So that's, I think, like a silver lining of, adapting to the pandemic. Most of my positions, I have 11 allies currently serving in different nonprofits in Miami. And the positions are from community engagement, right? Like, so doing outreach, right? Like connecting community members to the services and programs that the organization offer, to mentoring, to building databases, so anything that is, again, in the behind the scenes, to help the organization, have better outreach or expand services, and so on. So some of my positions are hybrid, meaning that the allies are serving sometime from home and other times going in person, but most of the positions are fully remote, and trying to safeguard the allies, the members themselves, and the community that they're serving.
And I can add to that. We are a little bit different from Roxy in that our group is with, by the way, I'm Anna Midas with the Americorps Vista, and we have vistas throughout the state. So we're already working with the remote team on a day-to-day basis. And what was great was we really received a lot of support from Americorps when the pandemic started to happen. In all the schools, most of our vistas are placed with colleges, universities, and nonprofits throughout the state. So all of these were obviously transitioning as well. And we were really able to pivot and take some of, I honestly, not that this pandemic has been a good thing, but what it did force us to do is make all of the plans and the different things that we kind of put off because we're too busy in person with, with our programs all the time. There's just not enough time to make a database and to get back, get caught up on record keeping. And so everyone was able to really pivot, and it kind of creates this hybrid system is what we're really seeing. Is where we're at right now. Our volunteering, quite large, definitely overwording, especially with our food institute, serve the communities that they're in.
All right, thank you, Anna. You were breaking up just a little bit, but I know that it's going to be great. All right, who wants to share next?
I can go next. My name is Jasmine Newsom, and I'm a recruitment manager with Teach for America. I am also a 2-time alum with Americorps. I did Jumpstart in college and then went into Teach for America. I taught in Charlotte, North Carolina from 2013 to 2015, and have absolutely loved my experience when I was in the classroom, and recently returned back to the Corps to recruit teachers that are passionate about the same movement that I am passionate about as well. The main point of Teach for America is to end educational inequity. When I think about all the inequity that does exist in the world, especially in the U.S., I know that the bare bones of that and the middle of that is going to be education and access to education. Teach for America realizes that all students are not getting a quality education, and And so they have two solutions to that problem. The first solution is going to be the core member experience. It's a 2-year commitment in a low-income community where you will be leaving your own classroom. You'll get supported from Teach for America before you get into that classroom, while you're in that classroom, as well as after. And then also with our alumni network. So about 60% of our alumni end up staying in education, while the other 40% end up pursuing things like law, medicine, government, policy, nonprofit, business, honestly, anything that you can think of. But we have partnerships too with those schools as well as employers as well. So I'm excited to talk to you guys today. We have one more junior application deadline, and I'll talk more about that in the breakout.
Yeah, and Jasmine, what is it looking like right now in the schools versus how it was before? How has that environment changed for the teachers? Have most of them gone remote, or are they there in person? Could you share a little bit more about that?
Yes, so Teach for America has completely moved their programming to virtual. Now, it depends on the region that core member is going to be in, whether that school district has went back in person or not. And so we have some people that are hybrid, some people that are both virtual and also in person. We have some people in person, and we have some people virtual. But Teach for America's program has become completely virtual to make sure that we are keeping our core members safe and make sure that we are working with them to make sure that they are giving the students things that they need as well to be able to deal with this virtual life.
Awesome, thank you. All right, who wants to go next?
I can go. My name is Dustin Arsenault. I'm Program Director for National Health Corps Florida. It's a public health-based Americorps program that's serving Northeast Florida and the Jacksonville region. So like a lot of the other programs that we've heard today, we partner with different agencies in the area, whether it be public health sector agencies, hospitals, medical centers, and the members who are volunteering with us and serving with our program are doing health-based services. So in different areas of health, whether it be mental health services, fitness and nutrition, exercise, maternal and child health, basic medical discharge and case management, things like that. And they do that for, I believe, 1,700 hours in about 10 and a half months in this program. So the program is just under a year. And it's served specifically here in Jacksonville. And so members get a lot of public health experience as well as medical experience. Really popular for people who want to get more experience, going into healthcare jobs or potentially going into graduate school education or medical school after this. So it's a really great experience for people who want to learn more about healthcare as well as health and equity, because a lot of the clients that we serve are in low-income areas, whether it be homeless clients, people who suffer from substance use disorder, LGBTQIA plus housing organizations, things like that. So we try to just make sure that everyone has access to healthcare. I know we've heard about access to education. We're more focused on access to healthcare and making sure that people have health education and adequate knowledge about health issues, infectious disease, things along those lines. And especially with everything that's been going on with COVID-19, our program's been a lot more active with making sure that people are getting screened as well as vaccinated now, because there's a huge movement to make sure that the mass amount of the population is vaccinated against COVID-19. So a lot of education and referrals in regards to that as well. So.
Thank you. I was wondering about that. How are they responding to the pandemic? And are all of your core members really doing in-person work, or do they have the option to be remote at all? What does that look like in terms of safety, if anyone, had that on their mind?
So when it comes to our positions, a lot of them are kind of variable. Because we're in public health service, a lot of the services are requiring people to be on site, but it varies. While some are on site, you may be providing services via web conference or, via telehealth. So the clients aren't necessarily coming to you face-to-face, but you're still in the office providing services from a set location. Some are a little bit more flexible, and you can serve remotely from home, like because of the organization's policies. Others, because of how intensive the services they are providing, they are actually on-site in a clinical setting. They, of course, have appropriate PPE and training on prevention and things like that. And because of how active our members have been in the vaccination efforts, a lot of members have already been vaccinated against COVID-19 because they are frontline healthcare workers. So it's one of the precautionary measures that a lot of the organizations take to make sure that the members who are doing direct service are able to do so safely.
That's great to know. Safety first. All right. Who is next?
I can go. My name is Emily Baker, and I am the program associate. I work with Americorps and CCC, which is National Civilian Community Corps, and we are a slightly more unique situation in that our members serve as part of a team in a residential setting, and so when COVID first hit, we had to pull everybody from the field, and we went on hiatus for a couple months while we regrouped. We figured out how we were going to conduct our program. Now we're all back 100% in the field and have been since June of 2020. And our members, pre-pandemic and still to this day, respond to community critical issues that affect communities all over the country, and we address them from those needs as they are indicated and led by those communities. So what that means is we're just supplying essentially labor to projects that our community partners all across the country are identifying. And so that could mean that our members are working mostly outside, building things, whether that's homes, trails, dressing response to disaster. So we're really focusing a lot on access to a variety of resources. We do a lot of disaster response, mostly natural disasters, and also our members are responding now to the pandemic, both in the form of working at food distribution centers, working in vaccine clinics. They're obviously not administering the actual vaccines, but they're working on crowd control, registering folks for getting the vaccine, and working on answering community questions about the vaccine and access. And so we've really been able to continue working and responding almost as normal. The main thing that I think has been an impact to us has been reducing our class sizes, just to ensure in the beginning that we have enough room for folks to isolate on our campuses as we bring people on board for their service.
Gotcha. Thank you so much. And CCC has always interested me just because you all travel and you're this really interactive cohort. So I can't wait for people to hear more about what you're doing.
Yeah, there's a lot of travel involved.
Yeah. All right. And who is next? We have Repair the World and City Year haven't gone yet.
I'm happily jump in. Hello, everyone. My name is Janu Mandel with Repair the World here in Miami. We are a national Jewish nonprofit organization, and our benchmark program, so to speak, the one that I'm lucky enough to oversee here in Miami, is really kind of a hybrid model that is both a service year fellowship and utilizing a community engagement model. So the idea is to mobilize young people to learn about issues of inequity in our local community. We have spent a lot of time investing in partnerships with local organizations who have been doing this work for decades. We're definitely not here to reinvent the wheel or to invent programming in a place that we should not be. I think one of the things that I appreciate most about my role in the organization is that we are very much staying in our lane. And Emily, what you were saying spoke to me so much, because similarly, we respond to the needs of our partners. So our fellows serve about half of their time in direct service to help our partner organizations build their capacity and advance their own missions. And the other half of their time is helping to engage the community to put together episodic service opportunities so that folks outside of the service year can also get involved in their local community. I'll say, as far as the pandemic is concerned, I imagine like everyone else, in the immediate aftermath, we all had to shut down and move to a virtual model. But very quickly, especially because we are in direct service with our partner organizations, as soon as they were providing for the communities, especially when it came to food distributions and immediate needs that came up in the beginning of the pandemic and persist even until now, we at some point had to really get back into our in-person service, hosting very small and safe episodic service opportunities for other people to tap into, with obviously providing PPE and outdoor service and all the things that we could possibly provide to ensure that we could still continue to meet the needs of our community. Few things still virtual, but a lot of our service work and our fellows even now and all of this current program year have continued to serve in person.
All right, thank you so much. And last but certainly not least, City Year.
Hi, everybody. My name is Africa Ramsey Zanoon. I'm a recruiter with City Year. I'm also an alumni. I served 2 years with City Year Miami. And we are an education nonprofit. We hire young people from around the country to volunteer in classrooms, typically middle and high schools across the country. And they serve as both tutors and mentors, helping students to succeed academically and social-emotionally. With the pandemic, the social-emotional aspect has highlighted a lot more than usual because students are at home. They don't have the outlet to come to school, have that social engagement, social interaction. So things like depression, anxiety, just regular teenage puberty issues are just really, rampant right now. In addition to dealing with the struggles of, having to do their homework and deal with barriers like internet access and all the other barriers that they're dealing with in these communities. So while we are an education-based nonprofit, again, we act as mentors and tutors in the classroom. We are not the main teacher. We are not the teacher's assistant. We're there essentially as a student advocate to make sure that the students, especially those who tend to get left behind or overlooked or just not supported simply because classrooms are overpopulated and teachers aren't able to provide students with the support and resources that they need. So we are there to build the gap, to bridge the gap. Also with the pandemic, we did go virtual for about 6 months, but all of our core members have returned to schools at this point, but not all students are in school. So similar to some of the other programs where core members are in school, but they are still teaching to students who are at home via computer. That's a little bit about us, and I'm happy to share more later.
All right. Was there anything else anyone wanted to share in response to what your other amazing programs were bringing up, that you're doing similar things, or maybe, based upon how things have changed, would you say that core members are getting the same experience, or is it just, it's just a transformed experience? Just as a quick last question before we go into our stretch break.
I think for us, our members are not getting, like we all are not getting, right, that physical connection, the human-to-human connection, right, beyond the screens. For public allies, we do overnight retreats at the beginning and in the middle of the program year, in the middle of the 10 months, really to create community, to play games, right, to get to know each other. And doing that in a virtual setting is very different, right? Like you can get to know each other, but it's just different, right? Community building is different, time building activities are different. But I think it just applies to all of us, right? With our personal lives and, seeing our friends and our family members. And we're trying to explore other ways to connect with each other, locally, and nationwide, throughout the program. But I feel like that's what we miss the most. And most of our alum always say that one of the biggest takeaway from doing public allies has been the cohort itself, right? The friendships that they create, the camaraderie, right? And that's, it's still there, but it's not the same. So I'm looking forward to being in person soon.
I would agree. In addition to being a big team building experience with the other people who are in the core, City is very much relationship based and dealing with the students as well. We like to get very energetic. We dance, we sing, we get real loud. Even outside of the classroom, we do a lot of community service projects like beautifying parks or different schools where we go in, we paint, we give them completely new landscaping and all those things. So a lot has been, cut back, scaled back, but I would say that the work is more important than ever simply because of the students.
I would echo the same thing for Peace Corps, and ours is even more traumatic because we literally go around the world. We're an international organization, so we cannot physically be in the communities that we serve in. And part of our mission is friendship. Our mission is world peace and friendship. So building those connections and making those friendships is crucial to our goal and part of our mission as an agency. So that's pretty much on halt, except for, me being any returned volunteer. I'm pretty sure most of us are still in contact with our host families back or friends that we met while we were serving. And then also being part of the agency now, I am in contact with a lot of the country directors that are still there working, and then also part of a huge network of returned volunteers. I mean, everyone that was evacuated and then all of the other 240,000 plus volunteers that have served with the agency. We can connect through a returned Peace Corps volunteer portal, and we stay connected that way. But yeah, with this pandemic, we've definitely taken a hit, not being able to make those in-person connections. But we'll be back one day, which I'm very excited about.
Yeah, I can go next, but what everybody just said is that in-person connection, I think, is just super, super important, and everybody has had to adjust. But what the pandemic has done is expose even more inequity. And it also exposed that the government and things like that and the school districts, they have the power to really give more to students. They always had the money. They always had the money to feed students. And so I am happy that this exposes so that everybody can see it, and that there can be more people that say, oh my gosh, we really need to be caring about the teachers. Oh my gosh, we really need to give more to education and funding and things like that. And so I think that the pandemic has definitely changed the dynamic of how we serve, but it has exposed more of our message to more people and what we're trying to do, which I really, really appreciate. And I'm ready to get back in person because I realize that in-person connection with students is one of the things that I think makes the program what it is.
That's so true, Jasmine. And it's so sad that it has to take a whole pandemic to get that, right?
Yes. I'm like, we've been talking about this. I've been talking about this since I was younger. So I'm glad that everybody is finally starting to wake up, even though it's late.
All right, so that was really awesome. I appreciate everyone sharing. I want to do a few minutes for Q&A from our audience based upon this discussion, just what's coming up to people's minds. And so if anyone has questions, you can write it in the chat, and we'll make sure they get answered. So does anyone else have questions for one or more of our panelists? Your face doesn't have to show, by the way, if you're worried about recording. You can just write it in the chat. In the meantime, if panelists want to keep sharing anything that came to mind as others were talking that they wanted to share that you might not share in a breakout room.
I can sort of touch a little bit more on that human connection with NCCC. I think one of the biggest things that we faced is that our members can literally not do our service except in person, or do their service except when they're in person. And so what that has meant is that our members isolate at first prior to their service and we test our members throughout the program as well. But also, once they're out serving on their projects, they're isolated in a family unit for that entire 10 to 12 months of service. So they're able to behave as normal while they're serving. They can hug their teammates, they can fall on, do team pyramids and, laughing piles or whatever it is that young people do. And it's for all humans do to, forge that connection while they're serving. And so in talking with some members of our class that just graduated, they said, all my friends have not had human interaction for months and months, and I've had it. So that has actually been one positive note for them. So that's been really nice to realize that as well.
Thank you for sharing, Emily. All right, we're not coming up with questions, but if there was anything else that you all thought would be relevant to this discussion that you all mentioned in your breakout room, feel free to chime in. No? Everything has been said. Oh, let's see. Yes, okay, I have an anonymous question coming in. Waiting on the anonymous question. Okay, who else wants to just share maybe a thing that you might not have shared?
I guess I'll say, yeah, being in this virtual world has presented, challenges, but then also opportunities. Like, there's people from all over the place on this call right now. And, I've been on a lot of calls where people are tuning in from Africa or Guatemala or, all over the world. And, I would not be able to have a meeting with all these people if it wasn't for these platforms. So I guess that's another piece of this pandemic. I mean, yeah, there's a lot of lows, right? But always got to see the silver lining, I guess. And keeping connections, but in different ways. And sometimes you just gotta be creative, right?
For sure. We have two questions. I'm going to share both of them, and then you all can share your answers based upon what it is for your unique programs. I have a question. What if I have no experience, and how do the different organizations look at that? And the other question is how much of these experiences are paid, how much of a time commitment it is for students, let's say in a tough economic situation, but they still want to help. And I think that our second question can definitely be answered more in the breakout room, but this person might not be able to go into each of the breakout rooms. So let's get to the experience question, because that is good. Let's say someone is just coming out of college, they hadn't had internships yet, or maybe they just don't realize how much experience they have that comes from past volunteering, right? We've done things, and then you're like, wait, but I didn't know I could actually apply that as a job skill and things like that.
Yes, I mean, you made a good point, Naomi. So if you went through college, although you don't have a professional, if you don't have a professional experience, going through college already prepares you, well for something, right? Which is different than someone just coming out of high school, right? Like that is that might not have had, right, that experience. So for us, it depends, right? It depends what type of background. I think in the interview process, what we try to assess is a baseline, right? And depending on the positions that we have available. Some positions are more entry level, right? Anyone, can get some training and just pick it up. So as long as you're willing to learn and willing to hit the ground running, I am sure that, people, everyone have gifts, right? And we just need to tap into that potential and those experiences that we have had. Some other positions do require, especially this year, I had some positions that require a certain level of skills, or in the case in Miami, being bilingual sometimes is necessary depending on the position. But I think we work, and what I'm excited about this collective is that we're working together to help our members, either, maybe if Public Allies wasn't for you, maybe another of these programs can be good for you based on your needs and based on your interests. So I think it's a case by case, at least for us, it's a case by case scenario.
I would say for city year, we take people from all experience levels. You just have to be between the ages of 18 and 25. So any major background will apply, because, again, it's mostly a relationship building program, mentoring, leadership. So the skills that we'll need and that you'll develop are skills that are transferable to many different industries.
And I'm seeing some answers coming in through our chat as well. So because we will be wrapping up this portion in about 2 minutes, but of course in our breakout rooms, you can continue to answer in depth. And how about, these are all paid experiences, right? Raise your hand if your organization pays. City Year does pay too. It really there's so many amazing benefits, and I was gonna share this after the break, but I might as well just share it now because it's pretty exciting. uh, well, all of our amazing programs do pay, and you know what? It's a good job opportunity, Africa. So, but Americorps just got $1 billion in support from the federal government for their programs. Yes, everyone who does service does it for the love and to make some money as well. So the $1 billion that was provided will boost our programs. I believe that there might be extra stipends, possibly putting it towards education award. So it's really a great time to be doing a career in service right now. We're getting lots of support. The nation needs it. The world needs it. And I think that just from what we've heard everyone share today, you are going to be doing something that is going to make such an impact on your own life and others. So, yes, service, service, service.